You don't have to do all the work. Our clients are wonderfully capable. We start with the smaller muscle groups and go to the bigger muscle groups. So we have done the sacrum plus external rotators, and we are going to now check the sacrum and the fascia of that lumbar spine. Stack the sacrum, and we then just mobility test the lumbar spine just using the fingertips of our hands and just checking, okay, how does that feel? Okay, how does this feel? Now my model doesn't have a lot of dysfunction, but I can feel that this tension is a little tighter on the left side than on her right. So what I'm going to do also is I am going to save my hands. I am first going to do release here just on this section, and then again do by manual. That will always work well. So you can use your fingertips, sink into that tissue. Okay, I have sunk in, I am checking in all three planes, I am stacking. Beautiful. So that is my stack for her fascia here. This is not really a muscular release, it is myofascial. So I stack and I just have the person inhale. Go ahead, inhale into the belly. You can see my thumbs moving apart. That is a great opening, and exhale. Beautiful. Adding in a gentle vibration and mobilization to open that tissue. So what I want you to take away as manual therapists and body workers is you don't have to do all the work. Our clients are wonderfully capable. Let them breathe into their tissue. Them consciously opening their fascia, just like my client here did, will get you quicker results. So now we will stack this fascia, the thoracodorsal fascia of that spine, and we will stack. And as you can see, this time I approach you differently. My fingertips are now communicating here, not downwards. So also we will notice my position, I'm facing the client's head because this is the upward relationship. I could always do it this way, but I am going to use bad body mechanics. I'm going to hurt my wrist. I'm going to hurt my back. So always paying attention to your body mechanics as well. So I will know I treated this. So I will go to restack her sacrum. There we go. And I will now stack her lumbar spine. Beautiful. And we will start with breath again. Inhale. Feel how my hands are moving apart. Stay, stay, stay. And exhale. So this is the beauty of the Martin method of myofascial release, or M3FR. We don't rush through the process. I will restack. And just the breath is making the change. Go ahead, inhale. Beautiful. Inhale, inhale, inhale. See that fascial line opening. We are holding it, and exhale. If we had to add more dimensions to the release, I would add things like holding the stack, making the client do a Kegel, tense the tailbone, and that adds in your muscle activation component. If I had to do motion, I would maybe tell her to like tuck and untuck her tailbone a little. Definitely a little difficult in this position. I would probably get her in side lying and then do more hip motions to activate this whole line down her lower extremity. So many treatment options that we will cover in our trainings, both online and in person. So be sure you follow us here and come join us and learn to up-level your skills. See you soon.